cross-section of skeletal muscle tissue reveal the skeletal muscle fiber or cell, the matrix, the cells are composed of myofibrils characterized by rod-shaped or round ovoid nucleus, eccentric in position. LS, longitudinal section of smooth muscular or muscle tissue, revealing spindle-shaped fiber, rod-shaped nucleus, large rod-shaped nucleus, located at the broadest part, and very limited matrix. LS, longitudinal section of cardiac muscle or muscular tissue, revealed muscle fiber or muscle cell, the branching, the highly specialized structure located between two neighbored muscle fiber and at the branching point, the intercalated discs. The matrix, limited. The cell fiber is cylindrical in shape or tubular, uninucleated, having round to ovoid nucleus. The cytoplasm is striated into thick and thin bands. This tissue is an epithelium. Which type? Thus the question, identify the tissue type. It is pseudostratified, ciliated, columnar epithelium, rich with goblet cell and cilia at the apical surface of columnar cells. E here means epithelium, C cilia, G goblet cell. Identify the tissue type, the upper tissue type here. Transitional epithelium, normal shape. It is stratified, composed of more than one tissue layer. The basal layer is cup-shaped, intermediate layer. The superficial layer is bulb, dome-like or cup-like. In normal state, what do you mean by normal state? When the urinary bladder is empty. Two sections or a slide revealing the normal form or shape of a transitional epithelium, thus empty viscous or empty urinary bladder, stretching or distended The cells here are transformed. What do you mean by transformed? Change in cell shape according to function. Since urine present in the urinary bladder, the cells are become more flat, more distended, more stretching. How you can differentiate between the normal shape and the distended or stretching cell shape from the superficial tissue layer? If it is dome-like, bulb, or a plant, cup-like, it is normal and the viscous is empty. If it is flat, stretched, the viscous, what do you mean by the viscous? The internal cavity of the urinary bladder is filled with urine. Cross-section of jejunum, which is part of the small intestine. The internal lumen or surface is lined or covered by simple columnar epithelium. Enlargement of the box or window segment indicate the columnar shape of cells having goblet cell, the nuclei ovoid, having regular pattern of arrangement located at the same plan, and the apical surface is striated, مخطط مسنن. Enlargement of the previous slide indicates simple columnar epithelium, the apical surface, the basal surface, the goblet cell, ovoid nuclei located at the same plan, and the striations at the apical surface called brush border. Which is an extension emerged out of the cell surface. We called it striations or a brush border. This slide represents cross-section of nervous tissue. Identify the marked structure by arrow. Cell body, which is the real nerve cell, having nucleus, nuclei, nucleus and the nucleolus, extensions, which is the dendrites, and cytoplasm rich with the subcellular components. The matrix rich with large numbers of neuroglial cells of different types, that is smaller in size and branched, comparing to the largest and longest neuron or nerve cell. This slide represents cross-section of the central nervous system, particularly the spinal cord. The gray matter and white matter, both of them composed of nervous tissue. This is the H-shaped or butterfly gray matter. This is the central canal of the spinal cord, lined with special type of neuroglial cells, which is the ependymal cells. The largest part here is the nerve cell, and the small dots represent the glial cells. Blood smear revealing a neutrophil or polymorphonucleosides. The nucleus is segmented into 4 loops, 1, 2, 3, 4, and the cytoplasm is rich with granules, thus called neutrophil or polymorphonucleosides. A neutrophil, because the nucleus is segmented into 3 loops, and lymphocytes, large, round, and nucleus. The cytoplasm is highly limited or evenly unclear. Again, monocytes, large, round, in nucleus, pin-like or kidney shape. In position, it is peripheral. The cytoplasm is ungranulated. الcytoplasm غير محبب. Why? Because it acting as a defense mechanism by phagocytosis, transforming to macrophage. Lymphocytes, the nucleus, large, round, with a small indentation, and the light area here represents the little cytoplasm, which is an immune cell, as you know. Very clear slide representing lymphocytes, large, round nucleus, small indentation, and little cytoplasm. Of course, the cytoplasm is non or ungranulated. Why? Because it is an immune cell. Sorry. Basophil, very clear. The cytoplasm is rich with granules, dark blue, which is basophilic granules, and horseshoe nucleus or S-shaped nucleus. Cross-section of cancellous bone or spongy bone. This is the caniculi or trabeculi of the spongy bone, in which the osteocyte is distributed irregularly, and there is spaces comparing to compact bone. This is the adipocyte or adipose tissue. Identify the marked structure. The arrowhead here represents adipocyte or adipose tissue, and here represent the trabeculae, which is the basic structural unit of cancellous or spongy bone. Cross-section of fibrocartilage. The basic cell is chondrocyte, surrounding by lacuna. The matrix is rich with collagen fibers. Number of cells is limited comparing to matrix that have large amount of collagen fibers. As you know, the fibrocartilage doesn't have perichondrium, which is the external membrane or sheath enclosing the fibrocartilage. Cross-section of hard or compact bone, revealing different Haversian system repeated in the tissue. Each one has a center or a core called Haversian center or Haversian canal, rich with what? With the blood vessels and nerve endings or nerves.